And I could
Actually, Katie, we can stay there.
Oh, yeah.
Okay, does everybody have a chair? That's important.
Yeah. If not, I can.
Does everybody have the chair they want? If not, too bad. Because get tough. You could, no, there's no sitting.
Oh, no, we're fine. We're good.
Is anyone sitting here?
No, I think.
All right.
I just want to get some food. Yeah.
Very quiet.
Same thing happened to me.
Sure you want to do this? It's an angry crowd.
Yeah, I can tell.
You can keep them not angry when you're very late. It's sort of like church. It's better if people kind of move in a little bit so that the presenter doesn't feel like they're at the end of the earth. Might interest you in a...
Thank you so much. Sorry.
Oh, of course.
You want to
Right. Let's make sure everyone's got... Who's sitting in that red chair?
Oh, yeah.
I don't know.
All right, that's me then.
Well,
Are you?
no, I'm just sitting in
Okay,
this
good.
very comfy chair.
I'm sitting next to Priyanka.
Moving it to
Okay, so this is Katie Leslie, our first speaker. Big round of applause. And where's Stacy Murphy? Where'd you go?
What inside?
Oh, she went inside. Oh, wow. We can talk about that. She is going to be our second speaker. And I just wanted to say, first of all, biggest thanks to our two speakers tonight, especially Katie, who just, when did we decide you would do this, Tuesday?
Yeah.
Yeah. So the redoubtable, unsinkable Jane Brown had to bow out, so it was a last minute so we could maintain the ladies' night theme, which, no reason for that. There's that song, which is kind of cool. Anyway, yeah, so this is our fifth Chautauqua, and I'm very appreciative for everybody who is here because you guys are what makes Chautauqua happen, and it's exciting. How many people are first-time Chautauqua? Okay, so and Stacy's first time as well. Talk about bold, first time presenter. But just very briefly, and sorry for those of you who've heard this before, but what's the idea of the Chautauqua? The basic theory or idea is that as we get older, when we're little kids, like in 5th grade or 3rd grade, whatever, like we have all this in common. Like we're all doing the same courses of study, we're all doing the same sports, we're in the same school, blah, blah, blah. And you sort of have all these connections that are very easy, like when you get together to talk about whatever. But as we get older, you kind of move down into more and more specific paths, like your hobbies or your work, or your background is different from the people you're now around than their background. And it's a shame because we don't really have the opportunity to share some of those selves, I don't think, as easily. We can share more superficial things, or you can share deeper with people you're very close to, but like, I just got excited. Like I know so much, I know everyone here, and you're all really interesting to me. And you don't get a chance to talk about the most interesting parts of yourself in a casual, conversation at a cocktail party. So this is a chance for us to kind of find out more about everyone and share what we find exciting and interesting. Katie is going to talk about this topic of being a vet, a day in the life, and it's just like you saw in the PBS special. I mean, how many times have I called her? She's like, "Can't talk now. My arm is up to the shoulder in the back end of a cow." And then she's like, "Here, would you call her?" I'm like, "I'm not touching that phone." Anyway, no, it's not really true. She's going to tell us what it's like today. And then where did Stacy? Oh, Stacy. Okay, Stacy, you're going to talk on. Tell people.
Kings, Killers, and Cowboys.
Excellent. They're lurking in your past. You just need to get to know them.
Oh, cool.
So, thank you. Kate, take it away.
So yeah, I'm Katie, maybe Dr. Leslie in this context. And yeah, as Sam so kindly introduced me, I'm a small animal veterinarian in Durham. Contrary to what my slide might suggest or lead you to believe, I really only see dogs and cats at this current practice, but I've gotten the opportunity to work occasionally with a few other species. So I guess starting out, see what we're working with. How many of you guys have pets like dogs, cats that go to the vet? Okay, so like literally everybody. Awesome, love it. Cool. You can go to the next,
Job security.
next slide. So yeah, a little bit about sort of my veterinary history. Graduated from NC State in 2014.
Go Wolfpack.
So I've been practicing for about 9 years. My first job out of that school was at a very small practice in Hillsboro, not necessarily physically that small, but it was just me and my boss, and he owned another practice, and we were the two vets. So it was essentially solo at this rural-ish practice in Hillsboro my first 6 years out, and I really liked it. I think a lot of people hear that and are like, oh my gosh, how did you ever do, by yourself? And I think Dr. Miller was the owner of the practice, and he was very supportive by phone. The practices were about 20 minutes apart. If shit really hit the fan, I could be like, come save my butt. But no, it was really good. And then about 3 years ago, I moved to Park Veterinary Hospital. We're in Southwest Durham. I know we have at least one person here that brings their dog to us. Awesome. If you guys drive by that area, we're the ones with the kind of funny, punny signs out front. So you might see that as you drive by. But yeah, that was a really big shift. We were an 8-doctor practice. So it went from mostly solo to 8 doctors, but it's a really nice supportive environment. And my commute went from 25 minutes to 4, so that was really good. And just in case you guys thought I was, having some conversations about small and large animals beforehand, in case you guys had any impression that this talk was going to be about large animals, I will have Jim show the next slide, which is the extent of my knowledge on.
Ornery. Shoot.
Yeah, my favorite's the ornery, I think. So yeah, my kind of idea with this was just to give you guys an idea of a little bit of behind the scenes, what goes on in your vet's office. What do we do on a daily basis? And so to start with, I'll reveal our big secret, which is what we really do with your pets in the back.
Aww.
Cuddle them, lay on the floor, take pictures of them being stoned, carry them around in backpacks. That's the big secret. Though I will say, I sometimes will get on my assistants for the in the back. It's kind of like a pet peeve of mine when you're saying this. I'm like, yeah, we're just gonna take him in the back, the treatment area. The treatment area, sir. Okay. So yeah, without further ado, we'll start in on kind of an average day. So I picked an example of a surgery day for me, where I do surgery in the morning and then manage appointments in the afternoon. So I get there about 7:45, kind of briefly check out my surgery patient. So we will have, for the most part, one of the doctors at the practice will have seen these patients in the past, a couple of months. They will have had pre-anesthetic blood work, checking out liver, kidney function, make sure that's all okay. But we still do kind of a brief exam the morning of, make sure they're still healthy. It's mostly just a brief glance, no one's actively sick. Yeah.
So you don't only do surgery on the animals that you see, you do surgery on animals that you've never seen?
Yeah, we try to keep it as consistent as we can between, the doctor that saw the pet and recommended the surgery. But with scheduling, each of us has a day of the week, and so if the owner's schedule doesn't line up, it's sometimes different. But yeah, and we'll get to, all the doctors are pretty collaborative with each other and kind of filling each other in. And then that's kind of part of these morning assessments too, is there is definitely a possibility that I haven't seen this pet before, and so I'm kind of doing a little brief exam, checking them out. So yeah, do that real quick, really just kind of listening to hearts and lungs and making sure they're healthy. Go next. So then, one of the things I really like about Park is we do doctor rounds every morning. So everybody that's there for the day, we take about 20-25 minutes, check in with each other. If anybody has a case that they're kind of working on or have questions about, we can run it by each other. you know, there's 8 of us there, usually 4 or 5 on any given day, and so you're kind of getting, you know, each of us having the 10 to, you know, 25 years of experience each, but you're pulling that together and getting like 100 years. So it's pretty nice for bouncing ideas off of each other. Our topic on this particular morning was, hey, we have this new vaccine, distemper vaccine for cats, and a couple of people were like, I feel like I've seen cats react to it like it stings, like what do you guys think? And kind of saying like, well, maybe like 50-50 for me, and we're like, okay, let's see if we can find a different brand just to, you know, make things a little smoother for our cat patients, like the more we can do to make things, you know, less negative for them. So yeah, finish up with rounds, I head back downstairs. In the meanwhile, while I've been in rounds, my surgery technicians have been calculating drugs for my patients, drawing those up, kind of getting everything prepared. And then I come down and basically sit there like a bump on a log for about 10 or 15 minutes while my surgery techs place an IV, induce my patient, place an endotracheal tube, get them all hooked up to monitoring equipment. In this case, I guess her, because we're talking about Tonka, who is in for her spay. And then once they're moving out of our prep area into surgery, I kind of take my cue and go ahead and scrub in. So yeah, we scrub in, sterile procedure, same as we would for a human, and get all ready and suited up there, gown and gloves and everything, and then going to do my spay. I always say another pet peeve of mine is the idea of the routine spay, which is routine in that we do it a lot, but it's I would say 4 out of my top 5 like pee in my pants moments in surgery have been spays. So they're definitely involved surgeries. You know, we're in there and tying off major blood vessels. I've kind of said, give me like a GI foreign body any day of the week over a spay. So, but yeah, all in all, you know, it is one of the most common surgeries we do. So that goes pretty well for Miss Tonka. So after I'm done, I scrub out, kind of de-gown and everything. My surgery techs sit with my patient while she's waking up until she's awake enough to take her tube out and then get her all settled in her surgery cage, which is kind of back in our open area so we can still see her while we're kind of moving about that space and she's waking up. And then we got our next patient is going to be Skittles. She is a 10-year-old cat, and she has some pretty nasty feline resorptive lesions on her teeth. Does anybody have cats that have dealt with this before? Nobody? Okay. So super common in cats, unfortunately for them. They tend to develop these lesions where their body will actually start to reabsorb their own tooth enamel. And then they make this kind of proliferative, angry gum tissue that sort of fills that space, and these spots get really painful. So they're so uncomfortable for them that when we have them under anesthesia and we're kind of investigating the mouth, even just touching that spot while they're asleep will cause a reaction. Like they're so like wired for that sensitivity. So yeah, this kitty ended up having 7 extractions. And once they're really to this point of being eaten away, that's the only way that's really gonna get that patient comfortable. So there's no like refilling that hole or reversing the process, unfortunately. But the nice thing is they tend to feel a lot better, and people worry about are they gonna be able to eat okay? Definitely, they heal up really nicely. If you'll go to the next slide, Sam, you can see a little bit of what it looks like. So we take dental x-rays on all our patients as well. And these 2 teeth back here are normal, and you can kind of see the outline of the root. And then you get to this little guy, and the crown is still there, but all of this has been essentially reabsorbed into bone. So the, I guess, quote unquote nice thing is when they're at this part, the part under the gum line is fine. It's not painful, it's reabsorbed into bone. All we really need to do is remove the crown where they have those, and this you would, you know, if you were looking at the physical part of their mouth, you'd see that angry red lesion, and so we're able to just remove the crown close the gums over it, and everything heals up really nicely. Yeah.
Is that because they're not getting enough calcium in their diet, or?
We don't really know. I think as far as we know, there's largely a genetic component to which cats, and I mean it is a large, like probably 50% of cats will develop some kind of resorptive lesion. But yeah, we don't really know like underlying. We haven't been able to link it to any like dietary insufficiencies or anything. So wish we had better knowledge on that front. So we also have another question. Yeah.
He asked if there was like a genetic factor. Dietary. Is there anything prevented that the owner should be doing?
So, depending on the cat, brushing their teeth really can help. And there's like a surprising number of cats that you can kind of work with and train to accept that. So starting with just like kitty toothpaste on your finger and letting them kind of lick it and smell it, and then touching their teeth and like working your way up to a little brushing. That, and then really just kind of having them seen by the vet regularly, and not a whole lot that we can do to like prevent the lesions, but taking those teeth out early before they're at the point where they're painful and infected is really kind of the like prevention, I guess, that we have. So yeah, with Miss Skittles, as I said, and you can see here too, this is like the big canine teeth. So the normal one here versus this one that's starting to kind of reabsorb back into the bone. So yes, the Skittles took a very long time, about 2.5 hours that I'm in there just getting those teeth out. So then we move on to Maxine, who's a pit bull that's broken a tooth. And so with dogs, they have those big chewing teeth in the back. Those tend to be the ones that are a little more susceptible to fracture. I would say one of the most common, I have like kind of displayed the poster child here that we see dogs break teeth on, is antlers. I will say I'm coming from a place of no judgment, having lived this myself. I was the dumb vet that gave my dog an antler for Christmas, and he promptly broke his tooth, which I had to extract. So I like to tell people that, like, nobody's perfect, don't feel bad, but stay away from these really hard bones and antlers.
How do you feel about yak cheese?
I haven't seen it. I haven't seen anybody.
Is this a personal question, Steve?
Yeah, right.
I haven't seen anybody
Asking
break
for a
tooth.
friend.
I usually say like you want to kind of be able to dig your fingernail a little bit into something. Those guys seem pretty hard. So with caution. And I mean, the bigger the dog, you know, if you have a pit bull versus like a beagle, you know, they're going to be less susceptible to breaking a tooth. Though again, not impossible. So yeah, Maxine has this broken tooth, happened pretty recently. You can still see this kind of bright red pulp cavity there. And yeah, when they're fractured through into the pulp of the tooth like that, there actually, believe it or not, are veterinary dentists that can do root canals. We don't do that at Parkway. We don't have that kind of level of specialty. So yeah, in this case, I extracted her tooth. So similar process to the cat, but a lot bigger tooth, a lot bigger jaw. I always laugh because I get a lot talking to owners like, well, I only want you to take the tooth out if it's absolutely necessary. And I always say, do you know what it's like to extract a healthy tooth from a pit bull's mouth? There's a reason why we have the phrase, it's like pulling teeth. It's not fun. So yeah, with these big teeth and a fresh fracture, you know, the rest of the tooth is essentially healthy. So it's a pretty physical endeavor kind of digging in there and getting those roots out. And if you'll go to the next slide, this is kind of what we're trying to prevent with getting those teeth out when they're freshly fractured. Because here you can see this one had a fracture, and then when that pulp canal is open, bacteria can kind of make its way up to the tooth root. And so like this up here is sort of normal bone density, and this here is a tooth root abscess. So infection around the root, and then it'll actually cause this kind of swelling under the eye and can even rupture through the skin out from under the eye. So that's the goal, to not get to that point.
Oh, sorry, we're done.
Yeah. So yeah, that's the surgery morning. Like I said, my technicians are doing a lot. They do all the cleaning, they do the x-raying. They are really, really rock stars of the vet profession for sure. So yeah, when I finish up with that tooth, I have a little bit of time kind of catching up on some things. Records, I'm emailing lab work from the last couple of days. We've sent out, wellness blood work. I'm like, Fluffy, her kidney values are looking good and stable. Keep her on that kidney diet. Responding to emails like, oh my gosh, Fergus broke his toenail. What should we do? All right, let's schedule an appointment for tomorrow. We'll take a look at it. And then I do make myself take a lunch break. I have found that is quite important for me, just trying to take that mental break, and I sometimes have to force myself to stop because it just sort of, the phone calls and emails and records will sort of never end if I don't let them. So yeah, on this day, then I go into appointments at 3 o'clock. I have Strudel, who is a 12-year-old miniature poodle here for a wellness visit. So our sort of flow for appointments is each vet has a team of 2 assistants. So they kind of leapfrog the appointments, take them one after the other. So the first assistant will go up front, get Strudel from the lobby, put him into a room. They'll talk to the owner, how's Strudel been doing, what's she eating, any changes in her activity or appetite, etc. And then our rough goal is kind of to have me in the room about 10 to 15 minutes later. Sometimes that gets delayed both with the owner wants to talk about her other dog that we saw 20 years ago and tell us all about that, and then and on some days when we're really busy, the backup becomes more of, do we have an exam room available, to put the pet and the owner in, or are they going to be hanging out in the lobby for a little longer? But yeah, on this day, it's beginning in the afternoon. We're flowing pretty smooth. I get in the room by 3:10, 3:15, check out Strudel. She looks like she's doing pretty well, and do her yearly vaccines, refill her heartworm, flea and tick prevention, very important, stay on it year round, and yeah, Strudel is good to go. We do a lot of preventative lab work, or like wellness lab work, at Park, which is really nice. So we're generally screening dogs every 6 to 12 months, depending on their age. We're checking out liver function, kidney function, blood cell counts, and all of that, trying to catch any changes early, since they, of course, are not the best at being able to tell us when something's wrong. So we can go on ahead. 3:30, I've got Fergus. He is a golden doodle with an ouchy red ear. So he comes in while I'm kind of finishing up with Strudel. My second assistant is getting him in a room, set up. The assistants are really great. They can go ahead and they kind of know the drill. It's like, all right, we've got a dog with an ear infection. We want to collect swabs from the ears, take a look at those. Or we've got a dog with a UTI. We want to walk him for a urine sample, check that out. So yeah, in this case, my assistant has already gotten the history from the owner, taken little Q-tips and kind of dipped them in there with that nice gunky stuff. And then we'll spread it out on a slide to look under the microscope, and they actually can read the slides themselves, so they're looking for yeast and bacteria. In this case, we see a good number of yeast in this dog's ears, so we've got a nice, convenient leave-in medication. We'll clean his ears out, we'll treat them. The owner just has to basically not touch the ears for 3 to 4 weeks. We recheck them at the end, and I would say about 90% of the time they clear it right up. So that guy's pretty quick and easy. But as I'm
quick question, I think that might be a difference from I've never been to the doctor where they're like, oh, just stay here, I'm going to run this sample to the back and tell you what's wrong with you.
Yeah.
What percentage of lab stuff do you do in-house versus having to send out?
for like wellness blood work, we generally send out, but for sick pets, we run blood work in house. So yeah, if you have a dog that's kind of like vomiting, sick, not feeling good, we can check all of that, like liver and kidney values and everything in house as well, and get those answered right away. And things like these ear swabs, looking at stool samples if they're having diarrhea, urine samples. We generally can get diagnostic information within like 10-15 minutes in a lot of cases.
Do you ever feel like you provide better care to pets than
I know there are some human doctors in the audience.
I'm so sorry. Sometimes I feel like my dog gets better care than I do, and that's part of the reason. Like,
I think it's just different. Yeah, I think it's the wait. I mean, the wait times for sure are different. For specialists and stuff, though. Unfortunately, we're struggling a little bit recently too, just with availability and sort of being overwhelmed by cases, both like us as general practitioners and specialists. But yeah, I mean, I think a lot of times we do have, and I mean, maybe we function more similar to like an emergency room in some cases where we can do some on-the-spot treatment. So we're kind of between like a family practice and like an ER in some sense.
I never got a hug from my dog so.
Or carry her out in a
those we
backpack.
give out throughout every 2 hours.
Or kisses.
Mine does rub my
or
belly.
cheese whiz.
I think it's a procedure though.
Cheese whiz and peanut butter, yeah, they probably don't get that out there.
Or a treat.
Yeah.
You took that shot really well. Here's a sucker. That'd be nice.
Does Fergus have to wear a comb?
He didn't. I find with the ears, like if I would call this ear kind of mild to moderate. In some cases where they're really like red and oozy and angry, we'll either do a cone if they're really digging at them, or they make this little like kind of babushka wrap that goes around the no flap ear wrap, so that they can't like shake their heads and get them all irritated. So yeah, sometimes, but a lot of cases the meds seem to like work quick enough that they clear up okay.
So they don't have to put the eardrops in them anymore?
We sometimes do. It depends on like the organism that's there. So we see a lot of yeast, and the Claro is the name of that leave-in treatment, works pretty well for that. If they're more like rod-shaped bacteria, usually we want like a broader spectrum antibiotic, and that is more available in those like daily drops that people would use at home. And some people, like the leave-in treatment's a little more expensive, so some people are like, they're fine, they do really well with the drops at home, so we still do use those, but the leave-in stuff is a really nice like option to have, especially with those dogs that just they're really like irritated with their ears, don't want to be touched, and it's like, all right, we can do one and done, like just get it in there and then they're all set. So yeah, Fergus got the clean and Claro treatment and did really well. So yeah, he's quick and easy, but then just as I'm like patting myself on the back, get the receptionist coming to me a little bit later, asking about this sick dog. She's got the owner calling.
That's we don't really know why. There will be a brief intermission while our technical staff addresses the Steve Earle penchant of this.
I think it could have been.
Oh yeah, that could have been video.
Can we cover you with questions, or
Yeah,
do you
definitely.
need a break like most vets probably?
No, go for it.
Okay, so what can we as loving pet owners do to make your life easier?
I love that question.
That's surprising.
I really think, and I'm sure like I am preaching to the choir a little bit, just like being kind. And I really do think, what?
To whom? To the vet.
Everyone?
Oh, okay. No, not to your dog, but to the vet themselves.
Oh, I mean, yeah, please be kind to your dog also. But no, and I find it too, like our staff more so than to us as doctors. I think some people have kind of that level of like, oh, we're gonna put on like the happy face for the doctor, but kind of be a little bit of a jerk to the receptionist, you know, when I'm calling and they can't give me what I want. But honestly, all in all, I feel like we're spoiled. Like we have really great clients. I mean, I think this kind of area in our clientele, people do tend to be really understanding. But yeah, I mean, really just being understanding of, you know, sometimes being understanding and being willing to utilize sort of other resources if your primary vet has a day where like they just can't see your pet. You know, sometimes we would love to, and we really try to prioritize like our existing clients. But you know, sometimes we have 4 doctors and they're all just like elbows deep in their appointments. And so I'll touch on a little bit, but we've kind of got a new model, I guess, of veterinary urgent care that's popped up in the past few years. That's been, I'm a huge fan. You know, they're basically trying to fill the role of human urgent care as like an in-between step from emergency and general practice. So things like these, you know, minor injuries, you know, vomiting, diarrhea, ear infections, and things like that, you know, you don't want to have to go and sit at the ER for 6 hours, but your regular vet just like can't see you that day or the next day. You know, being kind of taking that as like taking on faith that like your veterinary team like really wants to help. And yeah, that's really what I was kind of gonna mention about this receptionist coming to me. You know, as soon as they're kind of asking me the question, I'm looking at our schedule. I'm kind of like looking at the day. What do I have coming up? Where am I? You know, do I think from these symptoms that this is going to be something that's pretty quick and easy that we might be able to squeeze in, or does it sound like this pet is really sick and we just don't have, you know, the resources at this point in the day to like take the best care of them? So yeah, that was kind of a long-winded answer,
No,
but
very helpful. Thank you.
yeah. So yeah, on this particular day, again, the receptionist come in. She's asking me about a sick pet. They said the dog has been just kind of lethargic all day. She's 14. She's a lab mix, and she kind of looks like she's trying to throw up, but she can't. And this is a very like ding 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 kind of to any vet, is that those symptoms really worry me for bloat. And that is a very like one of the few like extreme veterinary true emergencies where like no, they need to come in and be evaluated like right now. And so I say like, hey, I've got a couple of wellnesses coming up, go ahead and have them come in. You know, I'm doing a little bit of this mental gymnastics. Like, if I'm right, I probably need to send this dog to an ER if they're going to get further care, but I can at least kind of take, you know, do those initial diagnostics and take a look at her. And this, in this case, is a patient that I've, you know, taken care of for several years, kind of seen her through a few different things. And so, you know, if I can, I would really like to, you know, be a touchstone for those owners, even if they do end up going somewhere else that they've kind of seen, you know, their vet that they know. So, kind of anticipating that. Then we have Cleopatra, my 4 p.m. angry cat wellness visit. So this first picture is not an actual picture of Cleopatra because I did not take a picture of him when I saw him 3 years ago, and he was running around the exam room hissing and trying to climb the walls and had a towel thrown on him and poked in the butt with a rabies vaccine and got back in the carrier. But we live and we learn. Better living through chemistry. So this year I have sent Cleopatra's owners, and the name, by the way, I love, was Cleopatra was discovered to be a boy as a young cat and was then renamed Cleopatra. So this is truly on the left Cleopatra with a pretty whopping dose of gabapentin on board that the owners put in his food prior to his visit. And he is just a nice little snuggly kitty when he came in for this wellness exam. So this was a nice quick visit. He was very tolerant and got his vaccines done. Get the oh yes, and this is, I don't know if it will actually play or work. This is
Her motor's too loud? Is that the problem?
This is my very favorite kind of cat, which is the angry eater. Meaning that they are angry and they are not pleased, but they will accept our bribe. So yeah, we try to be as like fear-free as possible. So we use lots of food, baby food and churu for cats, squeezed cheese and peanut butter for dogs, you know, as much as we can. We don't scruff cats. You can see he's kind of bundled in a towel. And so we'll kind of bundle in a towel, hold them on the side. If they're really angry, you know, if it's beyond the point where they can be handled, again, drugs are our friend. So we use drugs as opposed to wrangling and stressing them out. So yeah, we finish up with Cleopatra. Receptionist comes and asks about another sick pet. Unfortunately, this one, it sounds like a dog at the dog park got a little cut on its leg. In this case, I have to say, like, oh, I'm so sorry, we just can't see him today. And this is where I will usually check in with our receptionist and say, hey, you know, have them call one of these urgent cares around. There's a couple urgent vet in Chapel Hill. Trust Vet in Cary is a new one, actually owned by my classmate, so it's good practice. But yeah, I'm just really glad, especially in this area. I think we're really lucky to have a lot of resources. So this next sick pet I send to the ER, or to the urgent care. So yes, then I get Sammy as this dog that has been trying to vomit but can't. And this x-ray is, this is her x-ray, is very classic for bloat or GDV, which is anybody that's had like big dogs that's kind of had this on their radar at all. Yeah.
2.
Ooh. Yeah, it's so their stomach will fill with gas and then flip, like rotate on itself, and that cuts off blood supply to the stomach, and has to be like, there's no way to treat it besides surgery as quickly as possible. And if you don't get in fast enough, that stomach will essentially die. Like the blood supply's cut off,
And they need the stomach, right?
it's pretty.
Okay, just
yeah.
okay.
Yeah.
Okay, just cut it out, reconnect the two.
Right, just like
Hey, he's a
remove the
lab.
Very
Why don't you
accurate.
eat the stomach?
It's fine.
When you say big dog, how big?
I've seen it. I would say like labish size and bigger. I'm probably like a 50-ish pound dog is the smallest I've seen it in. Like Great Danes, German Shepherds are kind of the poster children for it. As anything that's really like deep chested, when they've got that like tall, skinny chest and lots of room for this to happen, those are the ones that are really at risk.
Why? What does that happen?
They swallow air, so a lot of times it'll happen if they've been like exercising and then come in and eat really fast. So they swallow a bunch of air and that kind of inflates the stomach, and then it just, that pressure kind of like, there's enough room in their chest that as that air expands the stomach, it kind of twists.
Does that happen with horses too?
I don't know if it's their stomach.
She shoots them,
Oh
so she
yeah,
doesn't
I
know.
I know.
As soon as they show distress,
You shoot them.
They start acting owner.
so it can't be known.
But yeah, I think that's what they call colic. I'm pretty sure that
Yeah, yeah.
embraces a bunch of different things, but yeah, I
Okay.
think same idea.
That was chapter 9.
Yeah, exactly.
So in this case, Katie, sorry, you're probably getting this, but would you do anything with this, or just send it immediately to the ER?
So in this case, Sammy is 14. You know, I'm kind of presenting this to the owner, like, I'm really sorry, this is what's going on with her. Sammy was kind of already struggling with mobility issues, like she was on a lot of different meds from arthritis, had some days where she was struggling to get up. We had actually kind of already had some quality of life conversations about her before, where the owner was like, you know, I'm not sure if it's time to let her go or if she still kind of has some fight in her. And so, you know, I offered to her, hey, you know, the only way that we can treat this is to send her to, you know, emergency referral hospital right now, you know, have her go to emergency surgery. Either other option that I think would be very kind for her at this point would be to put her to sleep. And you know, this owner is just distraught. She's crying. She needs to call her. She's, you know, about my age, but you know, wants to call her mom and kind of get her thoughts and opinions and stuff. And so I give Sammy a little bit of a sedative and pain medications, just a little opioid injection that both calms her down and relieves some pain of that pressure in her stomach. I sort of at this point have my initial impression that we're probably going to euthanize her, which I think is the right decision, as opposed to, you know, sending a sick 14-year-old dog to an emergency surgery. But, you know, kind of letting, I have a mix between little pushes in that direction, but of course it has to be the owner's decision. Then they have to feel good about it. So I give her a few moments, and no stopping, so jump on into my next appointment, which is this sweet little kitty cat, Mia. She's just here for a healthy kitten visit. So kind of switch gears and talk about, you know, healthy kitten care, give her a little vaccines, do a first round of dewormer, squirting a little liquid stuff in her mouth. She hates that. But yeah, and we try to keep it, again, with the fear-free, a happy visit. We give her some turkey-flavored baby food, let her lick that off the table. She's pretty excited about that. And yeah, I get to send her on her way. So then 5 o'clock, got Turk. He's limping. He's a pretty young guy. Owner thinks he just kind of played hard and you know, then came up sore. So we talk about, hey, this may just be a soft tissue injury. You know, do my orthopedic exam, kind of feel him out. He doesn't really give me. He's a pretty brave guy. He's kind of wiggly too, so I can't do a great orthopedic exam. Nothing feels hot, swollen, painful. I definitely don't suspect a fracture. But the owner's pretty worried, and we do talk a little bit about, hey, labs can have hip dysplasia that can actually kind of start showing up at this age. Let's take some x-rays and just make sure that, you know, he's okay. And so, again, my all-star assistants lift and wrestle this 18-month-old lab up onto the x-ray table. Get some x-rays of his hips and knees. They look good. His hips are nice and seated in their sockets. There's certainly no fractures. So we give him the old Rimadyl and rest treatment, which is Rimadyls are kind of go-to anti-inflammatory pain medication for dogs, kind of like doggy ibuprofen, and tell him, you know, good luck with your 18-month-old lab, telling him he has to rest and be quiet, but do your best. So yeah, Turp's a good boy. So yeah, we get him all squared away, and then I go back in to check in with Sammy's owner, and she has decided that euthanasia is really the right thing to do for Sammy, and I agree with her. You know, the ups and downs of the vet world are, you know, we form these bonds with our patients, and they certainly don't live as long as people do, and so you know, we have the aspect of saying goodbye to our patients more often than we would like. But yeah, Sammy, I think is certainly, you know, in some sense, this case was a little bit of a mercy for her, in my opinion. She had been kind of struggling for a long time with her mobility, and mom just wasn't really ready, and I think this made the decision for her. You know, and of course, in the moment, it wasn't good for her to have to go through, but we got her pain med and sedative on board pretty quickly, and you know, that made things go pretty smoothly. And with these guys, our technicians are really great. They will go and place the IV catheter. We have a special room that has nice, we've got Hershey's Kisses in there, so give them chocolate if they're still eating and interested in food, and do a little, you know, have a nice quiet space for them to spend as much time as they'd like. And then I'll go in and spend a few minutes kind of sitting with her, talking to her, reassuring her, yes, I think this is the right thing, and that we're doing right by Sammy. And then we always give a sedative first, so we sedate them with propofol, so same as we would to go into surgery, and make sure that she's nice and unaware of everything, just falling asleep with mom there, and then give essentially an overdose of a barbiturate to so sit with Sammy, go wash my face in the bathroom. Still got my 5:30 appointment. This is Enzo. He's a nice little healthy puppy. This is a family I've known for a while. I know that they lost their older dog about a year and a half ago, and this is their new puppy. And so we kind of have this cycle of life. Switch gears again a little bit, but it's that bittersweet. Like it's tough to cycle back and forth like that sometimes, but ultimately you kind of have that reassurance of, yeah, this is what we do. We welcome the next generation of pup. So yeah. Any questions?
I'm gonna make the same comment as before. Again, better care of animals. Yeah, can you use
Do you think we should euthanize humans?
In the office?
Like somebody comes in.
On a 30-minute visit.
As long as there's chocolate.
Yeah, good point.
After pulling a tooth out, yes, and we would have wanted to be euthanized.
I felt like
So terrible.
my mom is a retired physician, and with stories that she's told me, like I would definitely support it. I mean, I think people say it to me a lot, like in the process of euthanasia, oh, this must be the hardest part of your job. It absolutely isn't. The hard part is when people can't make that decision, and I'm watching their pet suffer. I tell people all the time, like I could not be a veterinarian if we didn't have this option. Like absolutely not. So to me, I feel pretty passionately about like relieving suffering when it's appropriate. So.
Katie, I have a question.
Yeah.
So is more of your relationship with the animals or with the people?
That's a good question. It's really mixed. Like my gut answer to that is like it's 50-50. Which I think a lot of people don't think about the like human side of it as much. So there's a big component of that, of like kind of taking care of the humans as well. Walking them through those things and kind of bonding with them over. I definitely get especially close to the people with pets that have a lot going on. We're seeing them a lot. We're kind of troubleshooting things with them, and I mean they're definitely like special relationships, and both human and animals.
I just wanted to comment if I'm not jumping in, but like since I've gotten to know you, first of all, it's interesting to me that like as a veterinarian you cover like the whole gamut. I mean you don't do super specialist care, but like you're doing wellness visits, you're doing surgery, doing euthanasia. It's like that. I didn't really think about it, but like I don't like in human. I think there's a lot of distinction between you're an internist or you're a surgeon or you're a like whatever it is. It's like it's interesting that there's this branch of or animal medicine, mammal medicine. You do everything. But the two things that I've also been struck by is how much freaking dental surgery you do. Like there's so much teeth extraction.
Yeah, we do a lot.
It's like I never even thought about that. It seems pretty grueling. But also the interesting part to me is, I guess I never really thought about this before I knew you as a vet. But like I go to see my vet, I take my dogs, and they always seem very sympathetic. But I'm kind of, I never thought about it. Like if someone had asked me, I'd have said, oh, they probably put down like 2 dogs a day or something. So they're very kind, but I don't know that it affects them that much because it's like they're seeing. But talking to you and knowing you, it's been like, oh no, like not just you, but like the whole staff is affected when a dog that you've known for years has to be put down. It's like you say, you're washing your face. It's like, this is not just work.
Yeah, that's different.
And that's somehow reassuring. I mean, like, you know, you want the creature you love to be cared by somebody who, even though that's one of 100 or 500 patients, they really care.
And I mean, we pretty rare, but like occasionally we'll have a pet that the owner just can't bear to be there, and they are loved on for sure. I mean, we have, you know, everybody that's kind of around and not with another patient is, you know, petting them, feeding them if they'll eat. Yeah, it's definitely important to us that we be there in that sense. And yeah, to kind of address Amanda's question again too, like, I think a lot of my emotional response is pretty strongly based on the owner's demeanor. You know, I think we have people that are very, you know, they're sad, but they're kind of matter of fact. You know, this is my 18-year-old cat, like, I love him, but this is the end of his life. We kind of always knew this was coming, and that's kind of like you know, a sad but kind of a circle of life feeling, you know, like we're doing the right thing by letting him go. But the people, you know, that I've seen their dog every other week for 6 months and helped them through this, and they're just, you know, a mess, like that, you know, that affects us for sure. And a lot of times in those cases, like, everyone in the hospital knows this pet, and you have people, like the technician will kind of stop into the room and like give them a little scritch, and you know, it's, yeah, we definitely feel it.
Well, thank you very much, Katie. So maybe we'll take a 5-minute break to reload your drinks or your food. And this was a mistake on my part. So I am always running late, and we produce these events. And so David and Rachel show up always like 5 minutes early, and like, hey, how can we help? I'm like, go grab the sooty tiki torches and stick them in the rock hard ground. Yeah, that sounds good. So super thanks. Stacy showed up, having not only prepared her talk, but showed up early, and she made all the punch, and you know, similar attitude. Follow directions very well. Where's the music? You disappeared. Oh, there you are. But Amanda made all the food in like an hour. This is her one. Thank you so much. During your 5 minutes, do take a moment to sniff, because the fragrant osmanthus is out this time of year. Have you noticed it? And every once in a while it wafts over, and it's rapturous. So.
Say that again?
What is it called?
There's a bush that flowers this time of year, and sometimes in the spring, called fragrant osmanthus.
Osmanthus.
Or tea olive, or sweet olive is sometimes called. And it's one of the true delights of fall. So keep your nose open for it.
I've got the 4 bushes right there on the other side.
Oh, that's why we're smelling it so